Now, there's some dispute about how many quarantine beds we have available in the country, but there is agreement that very few of them are currently being used. There are at least 400 government-approved facilities where people exposed to the virus can be quarantined at no cost. So why are these beds not being used? Aisha Abdool Karim is with the Bhekisisa Center for Health Journalism. She joins us now. Firstly, Aisha, why do we need so many state-sponsored quarantine sites?
So first, I just want to clarify exactly who needs to be using these facilities. So I think there's been some confusion around what exactly is quarantine and isolation. People who have potentially been exposed to the virus but don't yet have any symptoms, or people who have been tested for COVID but are still waiting to get their results to find out if they're positive or negative, are all people that need to be placed into quarantine. And people who have tested positive for COVID-19 but don't need any medical care need to go into isolation. Those are the technical terms. And essentially the process for quarantine and isolation is the same. It requires that the person go into a separate room and that they don't have contact with anyone for a recommended period of around 14 days. And, President Cyril Ramaphosa mentioned this during his address to the nation, where he was like, this quarantine process is actually critical for breaking the chain of transmission of the virus and reducing the spread. And this is why this is a problem, is that for many South Africans, they live in overcrowded situations and they are unable to quarantine themselves in their own homes. So we're talking about a situation where you have multiple people staying per room. And then in that scenario, those people are unable to isolate themselves and put themselves in a separate space. And so that's why the government has essentially invested millions of rands into creating these state-sponsored facilities, which largely are actually renting rooms in hotels, lodges, B&Bs, guest houses, that kind of thing. And so these facilities are available for people who are unable to isolate themselves in their own homes, and that's why they need to go into these state-sponsored facilities. In terms of how many there are, it's actually a multi-stage process. So essentially what happens is, first, the sites are identified by the Department of Public Works. They then are assessed by the Department of Health, which is to make sure that there's adequate ventilation, make sure there's enough space to put in the beds, and there's a whole bunch of standards that they have to meet. And then once they've been assessed based on need that we're seeing at a provincial level, they get opened, and that's when people can actually come and stay inside of these facilities. So the problem has been that the Department of Public Works has identified almost 5,600 of these potential facilities, and of those, 9 out of 10 are privately owned hotels. These are very fancy hotels. A lot of them are luxury hotels in which the government is willing to rent rooms based on need. But only around 400 of the 5,000, which is 8%, have actually been assessed. And even fewer, only a third out of that 8%, are actually currently in use. So that's been a huge problem, is that there's been this, while these facilities are being identified and are available, it's just been a struggle to try and get people to try and use them and go into them.
All right, Aisha Abdool Karim, let's leave it there for tonight. That's all we have time for